Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com.
Let's get into the diabetic foot. It's a mixture of pathologies. It's a mixture of peripheral vascular disease, neurovascular disease with Charcot neuroosteoarthropathy, resulting in foot ulcerations to an insensate region of the foot. Osteomyelitis ensues, and of course, that results in limb amputation. So that's the cycle that we're trying to avoid. When we're looking at ulcers and osteomyelitis, we know that this type of osteomyelitis is from direct contiguous spread from an adjacent ulcer. This is not your hematogenous osteomyelitis that may affect patients in their youth. This is a specific type of osteomyelitis that's based on the pressure that the skin surface feels, and the breakdown of the skin, which you can see here, starts as a callus, moves up to an adventitial bursa. That bursa becomes congruent with the skin surface and ulcer forms, and then we have the propensity to become infected at the deeper tissue level. If you have an ulcer, which many people do to the tune of 9.1 to 26.1 million, then you are more likely to be admitted to the hospital to receive, unfortunately, 5% of patients with diabetes are going to have ulcers and 1% are going to have amputations. And when you look at the numbers, these are huge. Of course, we're noticing that people of color, Latinos, African American, and Native Americans have the highest incidence in the United States. And if you have an ulcer, you're already sick. You have nephropathy, retinopathy, ischemic heart disease, and strokes. So you're already in need of care. Looking at the ulcer can be a centering place for you to receive that care with the podiatrist and the foot care specialists at the center of the gatekeeping of your best foot health. We can have a variety of consultants who can give us additional information about the actual wound, about the status of the patient, their cardiac status, their renal status, and we're going to need a full team approach to impact this disease. But we know that regular foot exams and patient education make a difference. And so by helping to teach and elevate our patients and give them opportunities to learn about how they can impact their disease will certainly make a difference. And programs like this at RadPodSquad are part of that collaboration. It's my intention to help spread the word on what we can see in imaging to help our colleagues out so that we can all impact how the patient eventually does and decrease those abysmal morbidity and mortality rates. So that's the purpose of what we're doing here in RadPodSquad altogether. And specifically, this is a great lecture for us to discuss what it means to be well in forefoot health. What we want to avoid is the cascade that occurs with neuropathy. In neuropathy, the overglycosylation, too much sugar, is going to make a difference in your sensory, motor, and autonomic neural system. By having too much sugar around your nerves, it creates a demyelinating pattern. The demyelinating pattern can do one of two things. It can create an impaired perception to pain. So you don't realize your foot is laying on, say, a heater and it burns. And that creates a situation that has an open wound that can't heal. Furthermore, you can have small muscle atrophy. This is very interesting. It can help. We learn a lot about the biomechanics by seeing how the biomechanics go bad in these patients who have an imbalance in the flexor and extensor musculature, clawing of the toes to create a more stable metatarsal head purchase, altered gait, and calluses formed to create ulcers. And of course, we do not have healthy tissues, so there's autonomic neurovenous or arterial venous shunting occurring, and the cells, the pressure within the regions are escalating, and the cells cannot properly clear its waste, and this causes tissue damage. All of this leading to something that looks like this, where you have an ulcer, in this case at the 5th MTP joint, which was an area probably of a bony prominence that was not felt, maybe started as a small blister, and has now come to a point where we're at risk of infection. The pathophysiology, adding ischemia or poor healing, is an important portion of this. That's why peripheral arterial interventions may be part of the mainstay of the treatment to help prolong the vascular life of the tissues surrounding the forefoot. You guys are experts at assessing ulcers. We can look at the original Wagner classification, just looking at the size and depth of the ulcer. We can add then assessments of ischemia. Are the tissues vascularized? And then, of course, we can add how sick is the patient to put that in a clinical context so we know when the patient needs to be admitted. This is a huge issue. It costs a lot of money to admit a patient, so we want to understand who needs to be admitted, who doesn't, what are the best treatments for each of those groups. And all of that is in service to really helping the patient towards forefoot health and prevention. And these international working group on the diabetic foot has done wonderful work to help us all understand how we should be appropriately evaluating our ulcers and the patient itself to understand if they have a systemic signs of infection, which may indicate that they need intravenous or antibiotics or greater interventions. The bottom line, a large ulcer, you may have osteomyelitis, around 92% specific. Deep ulcers, obviously, higher risk of osteomyelitis.
Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.